Good evening, everyone. Welcome to the August Brunswick County Board of Education meeting for 2021. We'll begin with a moment of silence and then the Pledge of Allegiance led by Mr. Benton. Please stand.
Please direct your attention to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ladies and gentlemen, before we go to the public address, I need to say a couple of things. As everyone here knows, all over the place there have been public disruptions to Board of Education meetings. One of the places this occurs is during public address, and we have a public address policy in which we have set aside 20 minutes every meeting for the public to express their opinions about items. Tonight we will have public address with differing opinions, and as we all know, we have opinions going on about this, that, and the other, in which we have a lot of emotions, one side or the other. We have never had a disruption in a Board of Education meeting in this county. When these folks get up and express their opinion about a subject matter, we would appreciate it if you show them the respect that we've always done. It may not be what you want to hear, but they have a right to say it. Thank you in advance for that cooperation. Our first person for public address is Joan Hall.
Mr. Chairman.
Good evening.
Oh, hold on, Ms. Hall, please, 1 second. Let the screen go over. Thank you.
Mr. Chairman, Ms. Hall and the remaining folks are going to speak in public address. I need to read to you part of Policy 2310. It says discussions regarding particular individual employees, litigation, student records, or other matters which may be required to be kept confidential may not be discussed in the open forum setting. The chairman will have the authority. The chairman will have the authority or the responsibility to determine whether matters of discussion may be inappropriate and rule the speaker out of order if necessary. Presentations will be limited to 3 minutes per person or 3 minutes per organization. It'll be 3 minutes long, and at the 2.5 minute mark, I'll ring this bell to let you know you have 30 seconds left. The time is up here on the screen.
Okay.
And I think that will buzz at the 3 minute mark. So with that, Ms. Hall, you may begin.
Good evening. 5,200 teachers have signed a petition to continue to teach CRT to their students, even if they are in a state developing legislation to ban the curriculum. Parents need to know what is going on in the classroom. We already have a system for remote learning. Why not use it for parents to hear what their children are being taught? The teachers would turn on their laptops and the parents could listen in. Teachers would be less likely to teach CRT. This brings me to my topic, parents' rights. North Carolina did not sign the U.S. Constitution until the Bill of Rights were added. How come we do not have a Bill of Rights for parents? I couldn't find one, and other states have them. Why not us? Here are some rights parents should have, and this is from Florida, HB 241. First, the legislation finds that it is the fundamental right of a parent to direct the upbringing and care of their children. The state and any of its political subdivisions or any other governmental entity or any other institution may not infringe on the fundamental rights of a parent to direct the education, health care, and mental health of his or her minor child without demonstrating that such actions are reasonable and necessary. The right to direct the moral or religious training of his or her child. The right to access and review all school records relating to his or her minor child. The right to make health care decisions. A plan for parental participation in schools to improve parent-teacher cooperation, a procedure for a parent to learn about his or her minor child's course of study, including the source of any supplemental education material, procedures for a parent to object to instruction material and other materials used in the classroom, the right of a parent to opt out of any district-level data collection, and that is your social emotional screening tool. Question number 1 is to find out if the state needs to be involved in the family. North Carolina Health Department has no charts for any deaths from kids from 5 to 18, so I'm assuming there are none. Maybe I'm wrong, but they're not putting it on the website. So let the parents decide if they want their children to wear masks or not. And please, everyone here, remember that the experts told us 15 days to stop the spread. How did that work out? Thank you.
Our next person is Chris from Rumbusick. Was that close, Chris?
You were close. Yeah, very good.
You can tell us how to say it the right way now.
Aaron Bassick.
There we go.
Not too bad. Hello, members of the board. I believe the State House of Representatives has recently voted to limit the teaching of critical race theory in North Carolina schools. And I want to thank those of you who are working to keep CRT out of our schools. But I believe groups like the American Federation of Teachers and probably other groups will work to get some version of CRT into the schools in the future. That's why I want to shed a little more light on what is said about CRT versus what CRT could be in practice. Time magazine quoted a law professor saying, critical race theory ultimately is calling for a society that is egalitarian, just, and inclusive, and in order to get there, we need to name the barriers to achieving this type of society. That may sound quite reasonable. The Brookings Institute wrote that CRT does not attribute racism to white people as individuals or even to entire groups of people. Again, that sounds reassuring, that sounds good. But what might CRT look like in practice in the classroom? I compiled a couple quotes from elementary textbooks to help people understand what their kids may hear if this subject ever does make its way into our schools, into our classrooms. The following quote is from a book written for kindergartners and early elementary. It's called Our Skin, A First Conversation About Race. It states, a long time ago, a group of white people made up an idea called race. They sorted people by skin color and said that white people were better, smarter, prettier, and that they deserve more than everybody else. That's one quote, direct quote from the book. That seems quite contrary to how CRT is often portrayed in some media outlets. Another book titled Not My Idea, a book about whiteness, currently taught in at least 30 school districts and geared toward children as young as 6, shows a contract for white children to sell their soul to the devil, and it states that accepting their whiteness will get them stolen land, riches, special favors, and the chance to mess endlessly with the lives of fellow humans of color. Again, that seems quite contrary to how CRT is portrayed in a lot of media outlets. So again, thank you for working to keep CRT out of our classrooms and being skeptical to what is sometimes said in the media about this topic. And please continue to fight to keep it out in the future.
Next is Stephanie Hall.
I placed this on the table and handed it to someone. This is a copy of my comments along with some information to consider about COVID-19, along with some charts that pertain to COVID-19, particularly related to our county. So I just ask that you take the time to look at them, and I ask that my comments tonight be included in the record from this evening. I'm going to let everyone know that I'm specifically here talking mostly about high school students. I'm sorry, my children are older. We're facing another school year and a North Carolina toolkit that was put out by the state just weeks before our schools are set to open again, completely upending how our schools will be allowed to operate. And if there is anyone that's still under the illusion that the governor has left mask wearing up to the individual districts, I encourage you to read the revised toolkit, and you will see that's not the case. As of last Tuesday, there are 45 school districts in North Carolina that have opted not to follow the state guidelines, and 2 that are going to follow the state guidelines partially. I'm here to ask, why can't we partially adhere to the guidelines? How much money has our district spent on air purifying systems for all the schools and buses in the district, for touchless water fountains and hand sanitizing stations? While my husband and I firmly believe that it should be a parent's decision as to whether or not our children should have to wear a mask all day, at the very least, our children should be allowed to take their masks off once they are seated at their desks. Mr. Barger, I saw Facebook posts recently. You were up in Raleigh and you were supporting the Free the Smiles bill. When riding a bus, changing classrooms, or going out to the bathroom, if they must wear a mask to help supposedly limit the spread, so be it. But seated at their desks trying to learn, and while outside in the open air, please let them take them off. After all, the so-called science for the last year has been that once you're seated at a table, the virus can no longer get you. I have written previously about finding a way to live with this virus, now all the variants that may follow. I'm imploring the school board administration and teachers in Brunswick County to please make sure this next school year is about the students, returning to some sort of normalcy, consistency, and getting them caught up academically. Live instruction in the classrooms, not classrooms with kids glued to Chromebooks, with other kids at home glued to Chromebooks, watching videos all day. No extended periods of remote learning that only works for a small percentage of students and doesn't work for students with special needs at all. Let's find a way to meet the huge challenge of getting these kids caught up while having substantial amount of time and patience that it's going to take to get these kids caught up. Can the school day be about learning and still socializing in spite of masks, the virus, and the constant barrage of doom and gloom? What are we doing to these kids? More children have died in the past 12 months from suicide than COVID-19. I'm sure data will be presented tonight from our county's health department. When the statistics on the rising number of cases and hospitalizations are brought up, I would ask how many children under the age of 18 are currently hospitalized in Brunswick County. And after the health department is done, will someone from the district office be presenting any statistics on the current state of education in our county schools? How many students attended summer school? How many failed this year? How many high school students dropped out? How many students never showed up online or in person? Make it about the students.
Next is Amber Dennison. Williams not here. Caitlin Jackson.
Good evening, board members. I want to first thank you for allowing me the time to speak tonight. I'm not one to volunteer for public speaking, as it makes me incredibly anxious. However, when it comes to access to education, I'm willing to go outside of my comfort zone. I'm here to advocate for creating an environment that allows for the most consistent face-to-face option for students. Tonight, you may choose to make a decision about a potential mask mandate, and this decision must be based on the data and the current toolkit. This is not to dispute our community transmission rates of COVID are incredibly high at the moment. Vaccination rates among our youth are very low. There's also no denying what the toolkit mandates in terms of quarantining. The toolkit clearly states that if all students and staff are wearing masks and an individual tests positive for COVID, that the only person that potentially may have to quarantine will be that sole individual. If you look at the bottom of page 15 of your toolkit, you will find that in a mask optional situation, though, there are various scenarios of who will have to quarantine. I do believe that all board members, central office staff, and most parents here can agree that we have the same common goal of creating an environment that allows for consistent access to face-to-face instruction. As we all know, this is how children learn best. In order to do this, we as a county have no choice but to be proactive and choose to mandate masks for all students K through 12 and staff. I do not suggest this lightly. I know this is a sensitive topic, but once again, to refocus, our number one goal must be continuous access to in-person education for our students. This is not about a political agenda or a personal opinion, but simply a realistic view of the consequences of an optional mask scenario. To me, this is simply a priority test. Do we want our kids to have access to their physical classrooms and teachers? Do we want our student athletes to have the opportunity to compete? Do we want to try to get as normal of a school year as possible? If so, I think you must make the tough decision to mandate masks for K-12, at least for the time being. Potentially reverting back to Plan C for any grade level or school is something we should avoid at all costs. I know many of you have discussed an optional mask mandate for high school students, but please look at the local data. Vaccination rates for kids ages 12 to 17 was at only 1% in mid-July, according to our own health department. Hypothetically, if this rate has risen to even 5% today, that still means only about 50 students out of every 1,000 would be fully vaccinated. Based on this and the current high transmission rates, I do not think there is sufficient argument against masking high school students when you are making a data-based decision. I know it's incredibly hard to keep our emotions out of this at all times, as well as our own personal beliefs, but I'm asking that you truly consider the consequences of a mask optional situation. All of us in this room are on the same team at the end of the day. We all want what is best for our kids. I thank you for your time.
Thank you. Next is Michelle Williams.
Thank you for giving me an opportunity to speak tonight. My name is Michelle Williams, and my daughter will be a rising kindergartner at Belleville Elementary School this year. At 8 a.m. tomorrow, I'm supposed to take her to do her kindergarten assessment, but I have great hesitancy sending her to kindergarten in a few weeks, and a large contributor of my concern is related to masks. In March 2020, we followed every rule to keep our family safe, pulled our kids from preschool. I worked from home. Our necessities delivered via various subscription services. As an educator myself, I spent 18 months somehow managing to teach virtually with a 5- and a 3-year-old at home. At least she's not starting kindergarten this year, I told myself. I can be thankful for that. We have time for this to pass. But it hasn't. In fact, the latest numbers have shown that the pediatric cases are rising. And we've seen locally what happens when there isn't a mask mandate in schools. We must learn from their mistake. You sent out a parent survey, and as someone mentioned at the New Hanover County School Board meeting, it doesn't matter what the parents think. This is a public health crisis. We need to be listening to the guidance from the CDC. It is not a matter of if, but when and how much frequency our children will be in school with COVID-positive peers. The guidance is clear. Children who have been exposed but were wearing masks do not have to quarantine as long as they are asymptomatic. There is currently no remote option. If you do not require masks, how will you ensure our students do not have another year falling behind academically? How will the districts handle quarantining whole classrooms? How will you make up for lost instructional time? We are not doing everything we can. Why are we not doing everything we can to ensure our students spend as much time as possible being able to be in school safely? I would argue that you, as the school board, will make the most important decision for our entire community tonight, because what you decide will have far greater reaching implications than just what happens at public schools. It will impact our businesses that employ parents, daycares, churches. It will impact all community members. My son goes to a local preschool, Coastal Day School. His program was unexpectedly shut down last week for the last weeks of the summer due to a COVID exposure. Another student was positive, likely by their older sibling that attends the charter school. 14 months of no COVID exposures at this preschool, but it was brought to its knees. I am thankful that the preschool takes this so seriously. I was given less than 24 hours to make other child care arrangements. The numbers are rising. Many pandemic and epidemiology experts are predicting we'll be back to virtual learning by November. Now is the time to be proactive to minimize the ongoing financial, psychological, and educational impacts this pandemic is having on our community. If the goal is to do the best thing for the economic status of our county and secure less dependence for social safety nets, the masks must be mandated. Please make the right decision to mandate masks in public schools to keep our students in school, to help our businesses stay open, to keep our community safe.
Thank you. Next on the list is Francesca Slaughter.
Thank you, and I'm sorry, I did not realize I was on the list to speak, so I'd like to thank all of you for allowing me to say a few words this evening, and I'd just like to start with a few simple questions. How many of our children love to do homework? How many of our kids complain about certain school rules they don't like to follow? You see, our children are asked to follow rules and policies they don't necessarily like. Perhaps it's a dress code rule. Many of these rules are in place because it's for their own well-being, for their health and their safety. And yet, here we are today in conflict with requiring our children to temporarily wear a mask that weighs less than half an ounce to school to protect their precious health and life and that of those around them. We all share the same goal, and that's for our children to be in school with as little disruption as possible. After all, who wants to go back to virtual learning? I know my kids don't. They like to stay in school. They miss their friends. Our community is currently experiencing the highest rate of the Delta variant infection, with less than 1% of kids under 17 having received the COVID vaccine. Now, though, school-age children have infection rates higher than adults 50 years and older. How do we keep our children, teachers, and staff healthy and in school with as little disruption as possible? The answer is easy. We do it by wearing a mask. We can learn a lot from schools that have recently opened with a mask optional policy. Within the first few weeks, outbreaks have occurred, causing massive disruptions in learning, while children have to stay home and quarantine. Is that what we really want? Or do we want to keep things as normal as possible, keep them in school, and learn while staying healthy? It's really a no-brainer. Please don't be the reason why our schools are interrupted, why children can't go to extracurricular activities, and why games are canceled. Let's get our kids safely back in school and keep them there. Also, kudos to the school board leaders, Mr. Barger, Mr. Benton, and Dr. Oates, who took the initiative to meet with local medical professionals from Novant for the very best medical guidance. Just like we don't go to our local plumber for crucial medical advice, they went straight to the medical experts, regardless of their personal opinion their political affiliation, or their stance on mask wearing. It tells me that these individuals, for them, it was vitally important to do the right thing for our children, no matter their personal feelings. That is true leadership. Thank you for your time, and I'll conclude by urging all of us here tonight to be people of peace, kindness, goodness, and self-control. Thank you.
Thank you. Sarah Carico. Steve Gainey. David Little.
Hello, my name is David Little. Thank you for allowing me to speak. I actually didn't know I was going to speak because they said it was a very long list, so I'm not that prepared, but I would like to voice my opinion. I believe as a parent, I should have the right to choose whether I want to put a mask on my child or not and send her to school. If everybody places so much faith in these masks, then let your child wear a mask, but leave my child alone. That's all I'm asking. We have got to get back to some type of normality for our kids' life. And the data is conflicting everywhere you look. There's conflicting data. There are plenty of doctors and nurses that say that these masks cause more harm than they do good. We have upper respiratory infections. We have children breaking out with acne on their face because of these masks. We have kids that don't want to come to school because of these masks, and basically they feel like it's torture having to sit there all day and rebreathe the same air. As parents, we should have the right to choose whether or not our kids wear a mask or not. We should have a right to choose whether we want them to have a vaccine or not. And it's time for the government to get out of our business and allow the families to raise their kids once again. I'm a father, I'm a pastor, I'm a business owner, and the Bible teaches that Jesus Christ gives us salvation to set us free. And freedom comes from Christ Jesus. And now we have to put freedom back in our school system. We have to put freedom back in our communities and our nation once again. And that starts by a relationship with Christ Jesus. And it also starts with parents having responsibilities to raise their kids the way they want it. So I'm asking this local school board to help facilitate freedom back in this community. Thank you.
Okay, we're down to the board salutes. Mr. Seaman.
I come bearing a shout out to one of our leaders. Brunswick County Schools is full of course, what we describe as lifelong learners. The idea that we can be both the teacher and the student our entire life. There is a unique professional development program that helps principals, the leaders of our schools, improve their skills to effectively lead the schools as we adapt to what is an ever-changing environment we are feeling firsthand. It is called the Distinguished Leadership in Practice Program, and a graduate is in our presence this evening. This is a year-long program, so our leaders are juggling the normal responsibilities plus stepping up to learn some additional leadership skills as well. So, ladies and gentlemen, if you will join me in welcoming Dr. Jonathan DeBerry, principal of Town Creek Middle School, to the podium for a second. Come on up here, sir. Started his principalship right in the start of Pandemicville. Dr. Jonathan DeBerry, principal of the Town Creek Middle School, home of the Coyotes, by the way, recently completed this Leadership and Practice program, a year-long program for practicing school principals, and it's designed and provided by the North Carolina Principals and Assistant Principals Association. We wanted to bring him in front of you just to offer a certificate of appreciation and also just give some much deserving respect and applause for you, sir. So come up here real quick. Tell us a little bit about the experience.
To the board, to the superintendent, to the community, to the cabinet. The experience for me allowed me to gain some feedback on how we practice administration duties in North Carolina. It gave us an opportunity to meet with different principals across the state and to share your experiences, whether it was in elementary school, middle school, or the high school. So I'm thankful and I'm blessed and humbled to be able to stand in front of you, bringing this knowledge back to our students here in Brunswick County Schools.
Thank you, sir. Congratulations, Dr. DeBerry. You're still up, I believe, Mr.
Yeah, I would love to wrap up with some stats as we have wrapped up summer school. We've wrapped up the summer meals program. Just to kind of give you the nuts and bolts of how it all went down, Child Nutrition has successfully completed the 2021-22 summer meals program for any child who needed breakfast or lunch throughout the summer. It started June 7th. It wrapped up last week. In all, about 64,500 meals were given out to Brunswick County students free of charge, no questions asked. You just show up, say you need something, and we get it to you. Then in transportation, this is for the summer school program, the summer learning program. We had 53 buses running every day. They averaged about 5,300, so 5,300 miles a day. We had 1,371 students signed up for the school transportation program. So almost 1,400 riding the bus, and then those, of course, who were dropped off. And then speaking of summer school, 899 at last check. That number may be up from now, but 899 high school credits were recovered over the summer months. So a huge congratulations to the students for getting those credits, coming in and putting that time in to getting the credits recovered. A big thank you to all the educators who came in during the summer months to get it done. And a huge thank you to all the staff who worked our summer school locations in elementary, middle, and high school to help keep all these young minds fresh and ready for this upcoming school year.
Thank you, sir. Ladies and gentlemen of the board, we're down to approval of the meeting agenda. Everyone has a copy of the agenda. Is there any corrections?
Mr. Chairman, I'd like to remove action item number 2, as our guest from the Board of Elections isn't able to attend. Action number 2, the calendar approval, sir.
revision.
Yes, sir.
Any other items?
I'll make a motion to approve it with the change.
Second. We have a motion by Mr. Barger to approve the agenda with the change. Mr. Robinson seconds. All in favor, say aye. Aye. We're down to the minutes of the special call meeting for the superintendent's evaluation, a regular meeting in July, and then the committee meetings July 20th. Everyone has a copy. You have a motion to approve?
Motion to approve. Second.
Mr. Benton makes a motion to approve. Mr. Barger seconds. All in favor, say aye. Aye. We have a number of items on consent that's previously been discussed. We have a motion to approve.
Second.
Mr. Barger makes a motion to approve. Mr. Robinson seconds. All in favor, say aye. Aye. Those items are approved. We're down to action items. We have an appointment up at this point for the Board of Trustees for Brunswick Community College. And at this time, I'd like to move to appoint Ms. Ellen Milligan to that spot. Do we have a second?
I'll second it.
So we have a motion to approve Ellen Milligan to the Brunswick County Board of Trustees, second by Mr. Barber. Any discussion?
To say I'm very excited about that position with Ms. Milligan. She served up here for a long time, and she understands our needs and our relationships between the college and what we now need out of the college to feed our students. We're doing great things at the coast, but the kids have a lot of difficulty sliding over to BCC because their programs don't align properly with us. So I think Ms. Milligan's the right person to know what needs to be done over there to help us out.
Any other discussion?
I think it's important to recognize all the people that put in for that, Mr. Chairman. We have quite a few applications for it, and all very qualified people, but I think Ms. Milligan is uniquely qualified for the position. So.
With discussion completed and a motion and a second, all in favor for Ms. Milligan to take that spot, please say aye.
Aye.
So Ms. Milligan is assigned to that spot to represent the Board of Education. We're at the update from Dr. Oates from the toolkit.
Board members, what I'm going to do briefly is just to kind of take you through some information that we've gained since the last time we met, just to give you a timeline very quickly. You see in July 19th of this year, the American Academy of Pediatrics released updated guidance for schools that included universal masking. That last sentence there, all students 2 years and older and school staff should wear a mask. That was their recommendation. And 2 days later, that's when the state came out with the updated toolkit. Again, it was basically saying that students in K through 8 should require all children to wear a mask indoors regardless of the vaccination status, and then students in 9 through 12 should ensure that anyone who isn't fully vaccinated, including students, wear a mask indoors. And then just 6 days later, the CDC updated their guidance to include recommendations for universal masking. So that's just a quick timeline of what took place, as I'm sure we're all aware. The overarching goal for us in Brunswick County Schools, from the survey data that we sent out, we learned that parents preferred face-to-face learning over remote learning. Preliminary student data shows that we know educational outcomes are better in a face-to-face setting. And last year's quarantines and school closures disrupted learning and parent schedules. So our overarching goal is at the bottom, and that is to keep students in school and in front of their teachers for optimal learning. That's the overarching goal for everything that we're trying to do. As you're aware, the survey that was sent out to parents and staff regarding their opinions on masking, it was open on July 26th and closed on August 2nd. We had 3,237 responses for the question of the preference for the 2021-22 school year, and this was from the parents. 68.3% said that face covering should not be required inside for K-12. Regarding parent, guardian, and staff choice, 24% said that face coverings should be required inside for K-12, and then 7.4 said face covering should be required inside all elementary schools for all students and unvaccinated staff. So those are the results for that particular question. And then as far as staff was concerned, we had 905 responses to the questions, and 60% of our staff came back with face covering should not be required inside the K-12 schools. 25.2% came back with requiring all K-12 schools to wear face coverings, and 14.8% of our staff face covering should be required in all elementary schools for all students and unvaccinated staff. So that's the information. I wanted to make sure that the public was given that information, the results of those surveys, and you had that information as well, since that did stay out for almost a week. What I would like to do at this particular time is I see Mr. Chris Harrelson is here, and he has some of his team members from the Brunswick County Health Department. So I will give them an opportunity to give us a lay of the land, so to speak, as it pertains to COVID.
Dr. Oates, was that survey secure, as in one response per student, or were these open that anybody could respond as long as they had?
The duplication was as limited as we could possibly make it under these circumstances. So there may be a bit of duplication, but we. Ms. Harrison?
Okay. Thank you, Mr. Chairman, board members, superintendent, for allowing me to come and speak to you tonight and give you an overview of COVID-19 in Brunswick County, and also a little bit about the Strong Schools Toolkit and CDC guidance for schools. Like the majority of counties in North Carolina, Brunswick County has been experiencing an increase in our positive case rate since late June. Brunswick has a total of 10,830 positive cases, 165 deaths, 1,054 active cases, and 9,611 resolved cases. We have added 1,407 cases since the Independence Day weekend, averaging 40 cases per day. We have had 1,057 cases in the last 2 weeks, which is an average of 76 cases a day. Over the weekend, we had 370 cases and 2 deaths come in. This is the highest our case rate has been since February. Our COVID positivity rate is clearly going up. Also on the rise are the number of hospitalizations, the number of deaths, and the number of COVID outbreaks. According to the North Carolina Department of Health and Human Services, the highly contagious Delta variant may account for approximately 80% of all COVID-19 infections in North Carolina. The Delta variant is nearly twice as contagious as previous variants and may cause more severe illness in unvaccinated persons. The best way to protect yourself from COVID-19, including the Delta variant, is to get vaccinated. Vaccinated individuals have a lower risk of hospitalization and death, and vaccination slows community spread. There are many different providers and pharmacies in Brunswick County that offer COVID-19 vaccine, including Brunswick County Health Services. Currently, 55% of Brunswick County residents have received at least 1 dose of vaccine, and 52% are fully vaccinated. The North Carolina Department of Health and Human Services has also issued guidance for the control of COVID-19 in schools in the Strong Schools NC Public Health Toolkit. The toolkit is based on CDC guidance and provides schools and local health departments with COVID-19 prevention strategies as well as control measures, such as isolation and quarantine. The toolkit strongly recommends that all students and staff in schools K through 12 wear face coverings indoors. Wearing a face covering, along with physical distancing, hand hygiene, and other measures, is part of a layered mitigation strategy that helps to control COVID-19 infections in schools and shortens quarantine periods. For example, students who are not fully vaccinated do not need to quarantine if, after a close contact in a classroom or other school setting, masks were being worn appropriately by both the person with COVID-19 and the potentially exposed person. If students are not wearing face coverings, the toolkit specifies a quarantine period of up to 14 days for unvaccinated persons in the event of a close contact with someone with a case of COVID-19. However, the toolkit also specifies that students may complete a 10-day quarantine if the student is not presenting symptoms of COVID-19 after daily at-home monitoring. Additionally, students may complete 7 days of quarantine if they report no symptoms during daily at-home monitoring and the individual has received results of a negative antigen or PCR test on a test taken no earlier than day 5 of their quarantine. Either shortened quarantine period shall require the use of a mask upon returning to school. In North Carolina, the local health director determines the quarantine protocols for positive COVID-19 cases based on state and federal guidance. In the event a student receives a positive result, Brunswick County Health Services officials will reach out to them to inform them of the necessary quarantine requirements they must take. So in conclusion, we at Brunswick County Health Services support the Board of Education's efforts to reinstate in-school learning in a safe environment. By using the control measures recommended by NCDHHS and CDC, we can minimize the threat of COVID-19 infections in schools, reduce the time students spend in quarantine, and keep disruptions to schools and families to a minimum. Thank you for your time, and thank you for being a valued partner to Brunswick County Health Services.
Any questions?
I have a question.
Hold on. Mr. Stanley? Hold on. Hold on. Please. We're going to take a 5-minute recess. You guys need to either shut up or leave this building. Ask them to leave. You can't get out.
You work for us. That's not professional. Are we allowed to ask questions? No, you gotta leave. You gotta leave. That's what you're saying. That's not being fair. That's admin. I mean, we're asking questions for our children. Okay. And you're not even willing to hear us out. I don't even take a survey if you're not with me. Ever.
Hold on a minute.
Who was the survey? What's the sample survey? Yeah, I'll leave. I'm tired of it.
If you want to, this is not an open meeting. This is not an open meeting. This is not an open meeting.
This is our children, not yours.
You had, ask him to leave. You can't talk. You've already, your representative already talked, so that's the end of it. Please.
What they're saying, the CDC has changed their guidelines so much. Who knows? It changes week to week. It says
We're going to take a 5-minute recess and clear the room. We're going to clear the room.
Yes, you can. They're not being disruptive.
Not asking the question. Only during the public address are you allowed to address the board directly. If not, you can do it via email, phone call. Every one of us has everything posted online. I mean, I've responded over 700 emails this week alone.
No, I said you were fine. I said you were fine.
Yeah,
I never once said. This lady didn't speak out either.
Well, we understand that. This
It's not
gentleman
fair to
couldn't
make
even finish
everybody
his
leave that
presentation.
didn't be disruptive. It's not fair.
Yeah, but he couldn't finish his presentation, which is the problem. We have to, we didn't even get to discussion of anything yet. We still have questions with him.
All right, I call the meeting back to order. Anybody have questions for the health department?
Yeah. Sir, I've already. No, I've already forgotten your name. What was your name again?
I'm Chris Harrelson. I'm
Chris
Health
Harrelson.
Director for Brunswick County, yes.
Okay, and you work for Mr. Stanley, I assume?
Yes, I
okay.
do. Directly for Mr. Stanley.
And your job is to make public health recommendations and decisions as far as, even outside the pandemic.
Correct.
You guys do vaccinations, health services during the year.
Yep.
The responsibility of your agency is to provide public health guidance. Is that
Correct.
correct?
That's
Where
correct.
do you get your guidance from typically?
CDC and the North Carolina Department of Health and Human Services.
Okay. And within the normal duties of your job, you work with them regularly. Is that correct?
Yes.
Now, the supervising folks over your department is the county commissioners. Is that correct?
That's correct.
Who's the liaison to the health board? Who's the county commissioner liaison to the health board?
Miss Pat Sykes.
Pat Sykes is? Okay. Do they weigh into decision making at all, or the stuff that you tell us?
A lot of times they do, yes, sir.
Okay.
Say that again. They do?
A lot of times they do weigh in on it. In this particular case, we have not had time to consult with our advisory board.
But that board's not, it's not just the county commissioner. That board's made of doctors and
Correct.
And so on, correct?
Yes.
Okay.
It's the former Board of Health that's now the Advisory Board for Health and Human Services.
Right. So when you make a decision, you release the decision to us and to the community, that's in conjunction with them. You guys come to an agreement of some sort, or how does that work?
Yes. A lot of times we'll bring things before the Advisory Board, and then they will recommend to the county commissioners.
Okay. You know, guys, as we're talking about the mask stuff here, Ms. Moffitt and I worked quite a bit last year to bring these kids back to school, didn't we?
Yes.
And I want to keep them in school this year. Do you agree with that?
Of course.
Yeah. And what scares me is this bottom part of this page. We all know virtual learning hurt our kids last year. Okay? Now, some people had to be in virtual learning, and let me be fair, some people did good on virtual learning. Okay? But I don't want to put kids back in virtual learning who shouldn't be there, whose parents don't want them to be there.
Right.
And you've already quoted it, I believe Ms. Stephanie Hall also quoted it in her document here as well. The bottom of page 15 that talks about, I'm going to summarize it here. The bottom of page 15 that talks about the close contacts, if they're all masked, only the positive person or the person who's symptomatic has to quarantine. Is that correct?
That's correct.
So if everybody at this table is wearing a mask, okay, Mr. Lemon tests positive for COVID-19, he's the only one who has to quarantine if we're all symptom-free, right?
Yes, that is correct. I mean, this guidance is for students in schools.
I'm saying we're students.
But, yeah,
Okay.
yeah, if you're students, yes.
Okay. Now, same situation. Ms. Moffitt isn't wearing a mask. Mr. Lemon's not wearing a mask, but we are. They would have to quarantine. Is that correct?
That's correct.
Okay. So to keep the most amount of kids in school is going to be to, unfortunately, put a mask on.
That's the interpretation that I have, yes, sir.
Okay. Would that be the interpretation of your agency as well?
Yes.
Okay. I hate wearing this thing as much as anybody else does. Okay? I'm sweating under here. I'm one of the ones that gets acne from it. My kids hate it. They complain about it every day. But I want to keep these kids in school, guys. You know, all of last year we fought over and over and over. You know, and Ms. Marvin, you and I were called names over and over again. I want these kids to get back in school. We finally got them back in school. And I want to keep them there. I want to make up the gaps that we have from last year from the virtual learning. You know, I recall a conversation I had with Mr. Bill Moore a couple of days ago, former high school principal. And he said to me, we can't put masks on the kids. I said, I don't want to do it either. But I said, let me ask you a question. We're trying to make up the gaps from virtual learning. What is going to make up those gaps? Them being in a classroom with a mask on, or them being back at home on virtual learning again? He said, well, the masks don't work. And you know what? I got to be honest with you, you can find anything you want to online right now. You can find literally an article and information for or against anything in this world. So I don't think anybody really knows what to believe anymore. Okay? But he agreed with me, even though it's against the mask, he agreed with me the best way to make up those gaps in learning from last year is to be in the classroom. Now, does the mask interfere? I think it does. But they're going to mend those gaps much more in the classroom with a mask on than they are at home. Okay? And I want to make sure that we're keeping these kids in the classroom. So I thank you for coming down today. I know this is a very tense issue for you, it is for us. Nobody wants to do this. This is a hard decision. No matter what you do, a lot of people are going to be mad. Some people are going to be happy. But at the end of the day, we got to keep these kids in school, guys. That's all I've got.
I had a question. Were you on board last, February-ish? You were?
Yes.
So we were receiving, last school year, we received recommendations from the health department pretty regularly. We have a cluster here, you need to close down this grade level, this school, whatever. All of a sudden, around the end of February, we got a call from the health department telling us that those recommendations were done and you were withdrawing them all. That came to us through the superintendent. The next day we received a letter from the health department reinstating a limited partnership, basically. And since then, if I'm not mistaken, we have not received any recommendations for anything from the health department. Would that be correct, Dr. Rhodes?
That was correct.
So something fundamentally changed in the system on February 28th, I think it is, when this happened. Do you know what happened on that date and why they withdrew recommendations from us?
I do not, but if you don't mind, I will call upon my team, my COVID team here. They work with it every day down in the trenches, and they may have some insight. Do you guys, are you aware of anything that happened back in February?
That was. We shut down South Brunswick High School, and some of the board members received calls from a county commissioner, and then 2 hours later, our superintendent receives marching orders from the health department that all recommendations are being pulled. All closure recommendations are being pulled. And we are wondering, we of course asked for writing, we got this typed letter the next day changing our relationship with the health department. And this is the first time we've had a health department member before the board since. But, that leaves us to question, because you guys are giving us the advice on what we're supposed to do. We got a new change of relationship with you guys, and all of a sudden recommendations have not occurred. And, and now we're in months, and we've had other clusters, we've had other infections in the schools till the end of the school year, and nothing fundamentally has changed, but our relationship with you guys has, and that's concerning to me. I mean, I'm worried about, and we're leaning on you guys as our medical side, and I appreciate you're from the medical side, and that, and that means a lot to us, because normally that's not who we deal with. But I was just curious on how that happened, because it worries me. The day before you guys recommended closing the school, the next day you're withdrawing recommendations, and why we would get a withdrawal of recommendations is something we've asked for, but we've not received that clarification on why that ever happened. Okay. And I would just didn't, like you said, you don't know why, so that's fine. We'll direct those queries to Mr. Stanley.
I'll be glad to do some research
if you could, please. That would be helpful.
Chairman, am I okay to speak?
Sure.
Okay. Mr. Harrelson?
Yes, sir.
Thank you for coming, Mr. Harrelson. And, I apologize for this turning real ugly.
No problem.
And I know you're getting some very pointed questions, and I know you're an employee of the health department. And I'll answer Mr. Benton's question. It was political in nature, and I know you probably won't be able to get to the root of that as easily as it would appear to be. And I think we as a board understand what happened. However, I just have a couple of things. First of all, this meeting got to where I didn't want to see it go. The last thing I wanted to see was folks have to be cleared from the room, but things did happen. But I have studied this tonight and in the past several days, and 6 weeks ago, I too, along with Mr. Barger, Ms. Moffitt, I didn't want to see masks back. I wanted to unmask everybody, get them back into schools, and go from there. I hate the masks. I don't want to be wearing one tonight. I don't want to see my family wearing them. I've got family and friends on both sides of the issue. But based on the latest statistics, I believe just a few days ago, and you probably got this information as well, our local hospital is a 74-bed acute care facility. And it was at capacity as of Thursday. And over 30% was COVID. Quite alarming. I also understand that New Hanover Hospital is quite packed with COVID patients. And I'm sure you keep up with statistics and trends. This afternoon, or this morning, sometime around 8 o'clock, I learned that in the state of Louisiana, the Delta variant is now impacting pediatrics at an alarming rate. The critical care facilities are at max with pediatric patients from age 10 to teenage in the state of Louisiana. And this ain't hearsay statistics. This ain't from the CDC. This is factual information coming out of the hospital. Is it okay to say that's true information? Have you heard that this morning?
Yes.
So it's a fair assumption, and I'm not trying to sound like an attorney here, but it's a fair assumption that we're learning in the past few days, and probably the American Academy of Pediatrics. I'm a medical person, so that's who I look at a lot. I try to reduce my exposure to the political component of this. Yeah, the CDC is sometimes biased, and other information is sometimes biased, but unfortunately, that's who we have to rely on as professionals.
Right.
That's all we've got. And from a liability perspective, I'm sure Mr. Green would agree, that's really what we got to go on, because we're not immune from civil action when we negligently follow the direction of the rumor control deal.
Right.
But based on what you said, and based on my interpretation of the toolkit, if we fail to mask our students, let me back up. In the toolkit guidance and in the administrative codification, it clearly states that the local school board is required to work with the health department. We are required pretty much to take your advice. I mean, I think there's some wording in there that says the school district shall cooperate with their health department in determining or making a decision. Mm-hmm. That's pretty clear. And I would be pretty much an idiot to say, health department, I'm done with you. Don't want to hear from you. That would be pretty stupid. I think you have a master's degree in public health, I believe. Yes. I've looked at your credentials. I've done studying tonight, prior to tonight. I know what everybody's credentials are, their roles are, who's what. And it would be stupid of me, I have a degree in paramedicine, or I'm a paramedic credentialed individual. Pretty stupid of me to sit here and say, I'm going to discount what you have to say. But basically what I've heard tonight, if I discount what you had to say and say, students, you're not going to wear a mask, you're going to go to school, you're going to turn around, if there's been an exposure, we potentially are going to shut the entire school system down. And you're going to enforce that, because I believe you, not you individually, but I believe we saw enforcement action earlier last week. And you're going to enforce that.
Yeah, we have to.
Right, you have to. It don't matter if we're Brunswick County schools or charter school or for kids only. So you're going to shut us down. We could get an entire school district shut down, potentially.
Well, we steer away from shutting schools down. We think that's
we don't like that
bad
word
decision, but we certainly must quarantine and isolate.
Right.
And take those control measures and give recommendations to you guys to give you guidance.
Yeah, shutting down is an ugly word.
Yeah.
It really is. It really is. But I'm old-fashioned. That's just the way it is. It could lead to that. We might not want to call it that, but we got to call it what it is. But that's just where it's at. And so, you know, I really don't know what else to say. I hate the mask. I don't like them. I'd like to take it off tonight and throw it away. I know Miss Moffitt or who else may have some more prepared statements, but I am not qualified, nor will I risk a child's life tonight. I'm going to go to bed and sleep tonight, personally. So that's just the way I feel. And I hate we are where we're at tonight, but I'm going to use some common sense here. And the last time I checked, my salary wasn't from the Board of Education. I volunteered for this gig, and I'm not shouting at you. I'm just putting it on record. I'm doing the very best I can to be here, and that's what I intend to do.
What's the vaccination rate of our high school students in the county?
Let's see. The percent of 12 to 17-year-olds that have been vaccinated is 5%.
5%?
5%.
The state average is over 50, is it not?
I don't know.
5% of our kids are vaccinated in high school.
Yes.
Well, he's at 12. This is a middle school. High school.
Okay.
Yes. From 12 to 17-year-old, there are 1,720 individuals that are vaccinated.
1,000, so not even a high school worth of kids.
Yeah.
Okay.
What's the hospitalization rate of a child below 18?
We are not aware of any hospitalizations for a child under 18 or any deaths.
Yeah, right. Currently. Gotcha.
Not in Brunswick County.
You know, to add what Mr. Robinson said, we sat at our committee meeting before my trip to Raleigh to meet with Representative Miller, and I went up there to work on creating the smiles. So this hall is exactly right. But since that point, this document came out, the toolkit, page 15, the infamous page 15 everybody keeps relating to, and I was forced to change my mind. If I made an emotional response just as a parent, because my kids do go to Brunswick County School, it would probably be not to wear a mask. But we are tasked with making policy for 12,000 plus students here. It's not just my kids, not just Ms. Moffitt's kids, not just Mr. Benton's kids. It's for everybody's kids. And if the overwhelming goal is to keep them in school, I had to change my position. I'm man enough to admit that. And anybody that was sitting in this room wants their kids to stay in school. Unfortunately, these stupid masks have to be worn. And I feel for them. I don't think everybody should have thrown out of the room. I said that to Mrs. Lemon. I said that to Ms. Moffitt. I think the ones who were out of line should have been taken out of the room so we could have an orderly meeting and discuss this with you. I don't like putting the sheriff's deputies in this position. But we have to have an orderly meeting. If everybody would sit here and let us have discussion, we can have discussion after this thing. I'll stay here all night if I had to talk to them. But we can't do the business of the board with all this shouting and yelling. I wish the people who weren't doing that could have stayed. But at the end of the day, we need to do business as professionals and as adults because these kids are watching, guys.
It's a recommendation of Dr. Oates.
I have something I want to read,
Yes, ma'am.
For him or?
just to say it. I don't agree with the people that were thrown out of the room who were not disruptive. This is America. We have freedom of speech, and they were not being disruptive. I don't know why they had to leave, but this is what I'm going to say about masking. Masking is a delicate topic. It's polarizing, and I understand that. These are tough times that we live in, and there has never been a more difficult time to be a school board member. I think you guys would all agree with that. I have 2 graduates of South Brunswick High School and a rising sophomore, and I'm grateful to all faculty and staff who have endured the last 18 months. My desire, like you guys, is for all students to receive a sound quality education, but my position would be to make masks optional. It should be the choice of the parents, students, and staff whether or not to wear a mask. Masks are debatable. One study will find that they reduce the spread of COVID-19, and one study will find that they did not help protect anyone. One doctor will say yes to the mask, and one doctor will say no to them. I personally reached out to a pulmonologist, which is a physician who specializes in the respiratory system, and I asked for professional assessment regarding masks, and I quote, "Cloth and/or surgical masks do not reduce the spread of an aerosol particle virus such as COVID-19. In fact, cloth and/or surgical masks are full of moisture harboring germs such as strep, meningitis, E. coli, tuberculosis, and staph." End quote. Therefore, I would vote to make masks optional. All of those who prefer to wear a mask or a face shield can choose to do so. That's the operative word. Those who choose to not wear a mask should also have that option. Dr. Oates, I commend you for doing a wonderful job in providing multiple opportunities for all faculty and staff to be vaccinated. Children over the age of 12 have also had the opportunity to become vaccinated. The level of fear has paralyzed so many, and COVID will mutate, and there will be variants from now on. We are so afraid of becoming infected and dying that we can't get busy living. At the end of the day, the state nor a governing body of any kind has the right to tell a parent how to make medical decisions regarding their children. I believe in freedom of choice and the constitutional rights of all citizens. All Americans have the right to medical autonomy and the right to make choices for themselves and their families. And that's my statement.
Any other questions for the health department?
None by me.
All right. Thank you, sir.
Thank you very much.
Thank you, Mr. Harrison.
Dr. Oates?
Board members, at our last board meeting, when asked what I recommended regarding masking, my response was similar to yours. It was to allow parents to choose. My feeling at that time was based on the seemingly decreasing rates of transmission, as I felt that we were seeing the light at the end of the COVID tunnel. However, little over a month later, a great deal has changed. And based on the information that I and some of you have received from our medical experts, it's my recommendation to require masks in all of our schools for student and staff, and also recommend that we revisit this requirement each month as we stay closely connected to the medical professionals for guidance. Again, this is a recommendation that you can accept, reject, or modify.
Dr. Oates, if it's okay. Mr. Chairman? Sure. Okay. Dr. Oates, could you just cite your resources? And I understand Ms. Moffitt was making the comment as I did. We cited some of our resources, which mine were, I cited, I don't think I specifically cited, I spoke with a physician at Duke University in person, I met. My list could go on. But could you just cite that resource information in addition to the health department?
Starting, of course, first with the toolkit.
Yes.
Of course, our health department, and also in a very lengthy conversation with the health officials at Novant Health.
Okay. That was with, I did not attend that meeting, but that was with multiple staff with Novant, at least two, if not
correct.
three. Physicians, potentially.
Yes.
Epidemiologists, infection control folks.
Yes, sir.
Okay.
Yeah, and I feel for what Ms. Moffitt wrote, because literally, guys, you can find something for and against this, and every time you turn
Absolutely.
around. I don't disagree with anything that anybody in the audience was saying. But at the end of the day, I want to keep these kids in school, and the stuff coming from the state and from the governor tells us if we want to keep them in school, they need to have a mask on. That's what I'm doing.
I think it's clear. The toolkit was set up in a way to tie our hands, as the speaker said. It wasn't about us masking or not. They're giving you the choice. The problem is you're going to end up with 25% of your kids on quarantine immediately. I mean, just look at one child on a bus in the middle with 72 kids. We're going to lose at least half the bus because there's 3 kids to a seat. This was set up to make us fail and have to mask, or make the infection or quarantine at least, so prevalent that we basically were running virtual academies anyway. And that's my problem, and this comes down to sports as well. I'm really disappointed we only had 5% of our high school students vaccinate. If we had a higher rate than that, we wouldn't have any sports go down. Yes, quarantines are going to happen, but they're exempt if they're vaccinated, and that's really sad for me, because last year it was a tough year for people in sports. Like, all these teams, these kids work so hard, and then they have one player on the team go out and somehow get COVID, and now the whole team's in quarantine. They're missing games, can't be rescheduled. This is a tough situation, and the only way I see it with the way the current toolkit is structured is to mask at this point. And The only question I have is what to do with the staff members who are vaccinated, because the double mask, if you will, the double party mask requirement does not apply to adults. So it does not matter if is that correct, Health Department? It does not matter whether they are double masked or not. If they're exposed to a student, they're still going to quarantine unless they're vaccinated. So there is no benefit for putting the mask on our vaccinated staff. I see a negative on that is that students can't see their face while they're teaching. And that's where my only difference from Dr. Oates' recommendation would be at this time. I'd like to revisit this in 30 days as well after, we can, or ongoing, whatever we see fit to. We can always review this at any meeting, of course, but I'd just like to, I'd like to make a motion to follow Dr. Oates' recommendations with this small change of allowing our vaccinated staff to be unmasked while teaching.
I'd just like to add to your motion, Mr. Bender, if you could amend it for me, actually, to allow sports while the athletes are playing indoors. They don't need a mask so volleyball players don't need a mask while they're on the court.
I would totally amend my.
Yeah, so just for sports, if it could be amended so that the athletes that are on the court playing or when they're running around and stuff like that, we don't need them running around with these masks on. That's getting kind of crazy.
In accordance, of course, with the High School Athletic Association,
Right.
to make sure they keep their eligibility. I just don't want us to be in conflict with them if they require masks. I don't want to disqualify our students from being able to play or any eligibility issues.
Ms. Mott, you have high school athletes. What is your opinion of that?
Oh, I don't think a child should be playing in a mask at all. Running, my child was in physical therapy this summer, and I think I reached out to David. Yeah. She was almost hypoxic because she was riding the bike for her knee. And yes. Oof. And her oxygen level fell to 91 because she had a mask.
Yeah, so anybody doing the strenuous activity, however, doctor, that needs to be written.
And outdoor, of course, would be exempt.
Yeah, outdoor is exempt, but I don't want people on a basketball court, volleyball, wearing a mask while they're playing.
I agree with that.
Motions, we need a second.
I'll second it with that amendment.
Tori, did you get all that?
I believe so.
Okay. We have a motion by Mr. Benton, a second by Mr. Barger. Any other discussion? All in favor, say aye.
Aye.
All opposed?
I'm opposed. Are we voting for masks in schools? Is that what we're voting on?
Pardon?
Are we voting?
Yeah.
Well, I'm going to be opposed because I'm going to say optional, but I know I'm outvoted, so.
Fair enough.
Okay.
Fair enough.
Discussion. Next thing on the agenda is discussion announcements by the superintendent.
Today was the first day back for staff, teachers. We have a great deal of professional development that's taking place across the county from this point on. It was good to be able to greet a room full of beginning teachers. First time teaching, about 30 folks we had in there this morning, and was able to just greet them, and they were eager to begin, and I think the ones that we have gotten will do a great job for Brunswick County Schools. I will be canvassing the county, dropping in different meetings, but I just want to let you know that the teachers are back, staff is back, and everybody's ready to get back to business.
And we have 30 new?
There were 30 in that classroom and that at Bolivia this morning.
Thank you, sir. Motion to go to closed session.
So moved.
Second.
Makes motion to closed session. Ms. Monson seconds. All in favor, say aye.
Aye.